welcome to a special Health Affairs podcast episode. My name is Lauren Adler, and I'm thrilled to bring you a conversation with Elizabeth Popp-Berman. Beth is one of the authors behind a new article series from Health Affairs Scholar, co-produced by the Health and Political Economy Project and sponsored by the Commonwealth Fund. This series dives into what a quote-unquote political economy approach to health could really look like, especially at a time when our nation faces huge health challenges, from rising healthcare costs for patients to unaddressed social factors and stagnant and unequal life expectancy. The authors in this series describe some potential responses, covering ideas from social insurance to greater public provision of healthcare services to a focus on frontline care workers. Check the show notes for a link to the series at Health Affairs Scholar. Our guest, Elizabeth Popp-Berman, comes from the University of Michigan and is the author of the book, Thinking Like an Economist: How Efficiency Replaced Equality in U.S. Public Policy. Popp-Berman wrote an article for the series titled Advancing a Political Economy Approach to Health Using Lessons from U.S. Antitrust and Climate Policy. We'll talk about that and more. Beth, welcome to the show.
Thanks, Lauren. It's great to be here with you.
To start off, before we dive into the article itself, what is a political economy approach to health? And how do you think this is different from, what we might think of as the standard approach to healthcare policy or the economic style of reasoning you describe in your book?
Yeah, so when I think about what a political economy approach to health is, right, I think of an approach that takes a pretty broad lens to what health means and that kind of centers power and politics and economics in thinking about the conditions that enable or that shape health. So, so that means not only having affordable access to medical care, but people have the economic security that allows them to pursue the kinds of behaviors that enable health, right? Do they have a physical environment that promotes health? Do they have chronic stressors in their life, like racism? We know has an ongoing ongoing effect on health, and I think more generally, just do we have a healthcare system that prioritizes profits at the expense of more human-centered care? And so I think this is a pretty hard shift to make because we do have an orientation, especially in policy conversations, really towards thinking about how do we get people access to affordable healthcare, which is obviously super important, but that's kind of the main lever that we think about through which we try to improve people's health. And so it's sort of partly about zooming out from that. The way I'm thinking about this more generally does grow out of this book that I wrote a couple years ago, Thinking Like an Economist, which talks about the rise of what I call an economic style of reasoning about policymaking. And so this is something, it's historical, kind of focuses on change from the 1960s to the 1980s, and it covers multiple policy domains. So it covers health, it covers antitrust, it covers environmental policy. And so really, the book argues that over the period of a couple decades, really, you kind of have an advance of a new way of thinking about policy problems that really understands good policy to be policy that's either efficient or it's cost effective, and that kind of understands the role of government as being a way to make markets work better. And so what that meant in a space like health is that you get kind of this shift from thinking about broad, potentially universal programs, so conversations about Medicare that you were having in the 1960s or in the 1970s, conversations about universal health insurance, which were happening even under the Nixon administration, and towards a focus on expanding access cost effectively, right, and leveraging market mechanisms. And so that's kind of an approach to the health policy space that by the 1980s becomes dominant, and that you can kind of see really, really up to the present, but certainly through the Clinton health reform efforts, through the Obama administration and the Affordable Care Act, and that continues to some extent to the present. And so really the thing that I'm trying to say here is that in some of the other policy areas that I look at, like antitrust and environmental policy, you see a shift towards taking a little bit of a broader lens on the policy domain and thinking a little more broadly about solutions. We don't see the same kind of shift in health policy, at least not to the same extent. And so what this article is doing is partly exploring some of that variation across those spaces and thinking about what we can learn from it.
I don't think anyone would argue that there are policies outside of the sort of pure healthcare coverage landscape that would affect people's healthcare. And certainly there's a lot of focus on prevention and the sort of other policies that might affect health. But, you brought up antitrust and climate policy. And that's where, a big focus of your article here is talking about the sort of major shifts in those two arenas that happened over the last decade. And I think it might be helpful if you could walk us through those changes and explain why they matter.
I think in those policy spaces, you see in that longer historical period, you do see kind of a rise of, broadly speaking, economic reasoning about the policy domain and over the same time period, right? So that in antitrust, starting in the 1970s, you have a consumer welfare framing for thinking about antitrust becomes really central, and people really start to understand the purpose of antitrust as being primarily and really only about, are we keeping prices sufficiently low for consumers? Do producers have the capacity to raise prices above a competitive level? And so that's, one important issue, but kind of excludes a lot of things that were historically part of the antitrust conversation. So, questions about other ways that corporate consolidation might lead to concentrated power or downstream effects of consolidation, like impacts of small business loss on communities and things like that. What happens, though, is that by the 2010s, I think you're getting a lot of questions about the limitations of that approach. And so I think you've got the rise of platforms, you've got Amazon, Facebook, Google. And if you think, if Amazon controls 40% of all sales that are happening online, and it's got all this information about sellers who use its platform, right? But it's also competing them. Then what does that mean about competition, right? You've got questions about what's the role of platforms like Facebook in conveying political speech, and if these platforms are really important for political conversations, but the algorithms are shaping what people see. How do we think about that as a new kind of problem? And then I think there's evidence in other spaces, like for example, there's a growing body of evidence that concentration is also having an effect on wages, right? That there's less competition for employees, and so concentration's potentially keeping wages down in addition to potentially having an effect on prices. And so, so there's kind of this accumulation of new kinds of questions. And in reaction to this, you get this new Brandeis movement that is kind of political economy centered, and that takes this more expansive view of how should we think about competition? How do we think about ensuring that markets are working well? Is it more than just focusing on consumer prices? At the outset, when this conversation is starting to take off, it's seen as pretty marginal to the mainstream of antitrust debate. And so, 2015, 2016, you're starting to see articles about this, and there's a lot of pushback. It's kind of seen as beyond the pale, and it doesn't really feel like a perspective that is going to have a big impact. But it does not take that many years. It's by 2020 that when Biden is elected and is starting to look for a different approach to some kinds of problems, you see him do things like appoint Lina Khan to lead the FTC. All of a sudden, this approach that had been quite marginal becomes de facto the main approach that the White House is taking. You have this kind of shift in antitrust policy. You have really sort of a parallel shift in climate change, with a shift from thinking about cap and trade as kind of the only viable approach to policy change to saying, okay, well, if we can't achieve that politically, what are the other options? Which ultimately leads to the embrace of industrial policy under the Biden administration. And these are pretty significant shifts in how people think about those spaces. So in both of those areas, you have what start out as as changes that seem like they're pretty much outside the mainstream, that within a few years end up becoming much more part of the ordinary policy mix within Washington.
I think that just leads to the natural question of what changed, right? What is it? What are the factors that sort of help drive these shifts. I mean, the antitrust shift, I agree, felt pretty felt pretty sudden almost in how quickly it bubbled up. The climate one feels a little different in some ways in that you're still sort of dealing with the relative prices of clean energy versus not as clean energy. It's now just focused on dropping the prices of clean energy through the sort of Inflation and Reduction Act approach here. But, I'm curious, having studied this, what are the sort of the main factors here that you think kind of drove these pretty sudden shifts?
Yeah, and I think just to like pick up on your climate point too, right? I think you're right that fundamentally, the broad approach is still okay. We're going to think about how do we change the relative costs of these different forms of energy, right? And so it's sort of rethinking that kind of piece. But I think the one piece that maybe is actually different, that's sort of part of new political alliances that emerged, is that environmental justice conversations were really sort of embedded into policymaking as well. And so there was also a very explicit acknowledgement that, climate impacts are more likely to follow marginalized communities, that's something that we need to address directly. And so, so I do think you're right that maybe the shift was a little more abrupt in antitrust policy, but I do think you see it in both areas. As to why this happened, in both cases, in many ways, it's the product of a lot of political organizing and sort of coalition building that happens while people are not in positions of influence. That happens in sort of different spaces in the two policy areas. In antitrust, a lot of that organizing is happening in these relatively elite policy domains. So you see think tanks like open markets, and you see spaces like Yale has this law and political economy project that was doing a lot of academic work around antitrust. And so it's this relatively intellectual elite sort of organizing that is kind of trying to shift the conversation. In climate, it's a lot more grassroots. A big sort of landmark moment in climate policy was the failure in 2010 to pass Waxman-Markey, which would have been the big cap and trade bill. That was a moment that also fractured the environmental movement, in part around the issue of environmental justice, because it was sort of excluded from the cap and trade stuff. And so over the course of the 2010s, you have a lot of those grassroots, more youth-based, more environmental justice-leaning organizations starting to organize. By the later part of the decade, it's this sort of bottom-up kind of organizing that starts to bring some alternatives onto the table. There are things that, beyond just sort of this general idea of organizing in advance, there's some other things that the spaces share. One is that, both of these movements were pretty good at linking their issues to concerns that are sort of broadly resonant to the American public, right? Things that are resonant throughout American history. And so in antitrust, you've got sort of like a fear of concentrated power, right? Which is sort of a theme that has a long historical past to it. And you've got arguments about the fairness of the playing field. In climate, the key thing is connecting the idea of climate policy to jobs, right? Which had not really been the case in the past. And so industrial policy becomes a way not only to reduce carbon emissions, but to create good green jobs. And that's super important. And so I think in both of these spaces, people are really effective at building what the political scientists call issue networks around their issues that sort of cross different sorts of organizations, that brought different constituencies together, and that put people in a good position to, when the politics change, to be able to advocate for change. And the one last thing I'll mention is that I think another factor that was critical for both of these was they both had a really visible youth aspect to them.
I mean, even the antitrust world sort of bleeds a little bit into healthcare policy. Obviously, some of the antitrust action was focused on healthcare. Obviously, I'm a little biased by my own research, sort of touching on that intersection here. But I think this leads to sort of to two real natural questions here. One is sort of, why haven't we seen similar transformative changes in healthcare? And then, how do you adapt these lessons from climate and antitrust policy, and how do you funnel those into healthcare? Certainly there are plenty of similarities.
I mean, I think there is sort of one big difference in the policy spaces that is one reason you don't see the same kind of change. And I think that is really the success of the Affordable Care Act, because I think in both antitrust and climate policy, you had kind of a long buildup of increasing concerns that don't really resolve themselves. In antitrust, you kind of have this 50-year-old paradigm, new issues are emerging, you get sort of growing number of news stories or whatever about it, but nothing really major has changed. And so there hasn't really been any resolution to these building concerns. In climate, I mentioned Waxman-Markey, and that was a real moment of hope for the environmental movement during the Obama administration. And then when it failed, people were just sort of crushed and wondered, is this the wrong strategy? How do we rebuild this? Where do we go from here? And so there was this real period of soul searching. But by contrast, I think in health policy, you have the Affordable Care Act passed in 2010, and that's quite successful. But one thing it does over the next decade is that health policy conversation is pretty heavily oriented towards thinking about the Affordable Care Act. It's either defending it, or it's challenging it, or it's trying to expand it. But that becomes a very core focal point in health policy, in a way that doesn't open itself up to sort of broader questions about, well, are there more fundamental changes that we want to be thinking about? You do see one movement that is somewhat aligned with health policy, which is that kind of mid-2010s, you start to see some conversation about the care economy. And this is sort of initially coming from the space of people who are really focused on childcare and early childhood education, and who are interested in kind of organizing workers in that space for better conditions, but kind of gradually opens up to consider a lot of different kinds of care and starts to incorporate some health policy concerns into that. So that's maybe something that we can come back to, but I think is sort of the closest thing to a movement that is analogous that is really near the healthcare space. But I guess then second part of your question was what the lessons are for how we might think about health policy.
Yeah, and right, I think just to build on that, right, I think you make a good point, right? Had cap and trade passed, you probably would not have seen the sort of big push towards the sort of industrial policy approach. That also tees up both the Affordable Care Act and cap and trade policy. Both, were trying to improve their domain, but had created both winners and losers. I think part of the industrial policy approach on climate, part of that was let's create fewer losers and let's just sort of make it all about, let's just throw money at things and make it so it's predominantly winners. In this situation, I'm sort of curious, both broadly, how these lessons might be adapted towards health policy. And do you think there's something to that approach to health policy where, using less trade-offs and using money to kind of primarily create winners?
Right. So maybe there's sort of two ways you can think about what the potential lessons are, right? And I think one is just sort of how do you think about the kinds of actions that people took in these other spaces that sort of built the momentum for having sort of the people and the energy in place to try to motivate these kinds of changes once the political environment was ripe for them. In that vein, you've got the question of how do you think about building issue networks that are going to help you advance the kinds of approach to the policy domain that you want. These issue networks that were built during this time when they really did not seem particularly likely to be effective end up being quite important down the road. And so, 2016, 2018, even though, whenever AOC came out and started talking about a Green New Deal and it got some press, it did not really seem like we were in the moment when there was going to be some kind of major environmental legislation in the next few years. I think another lesson is thinking about how to build networks across different kinds of policy spaces and really thinking about how issue networks can align the interests of different groups. The climate movement, one way that they did that effectively was sort of by figuring out how to realign kind of the more traditional climate groups with these younger, more environmental justice focused groups so that they could bring different sets of political actors to bear when they're actually trying to accomplish policy. I mean, I do think that's a space where it's worth thinking about how these kinds of care economy movements that, again, have been based more on the childcare, early childhood education spaces, but that obviously have a lot of affinities with healthcare, and that I think those kinds of frames have the opportunity to bring in people who are interested in advancing the interests of particular professional groups, right? So physicians or nurses. In terms of thinking about, are there ways to align interests by basically creating incentives for everybody? I mean, I do think, yes, of course, that is always one strategy, but there's always the question too of, do you actually, if part of the motivation for doing something like the Inflation Reduction Act was to create policy change that was going to be really durable by kind of giving new people interest in maintaining it, I think it also raises some questions of is it actually going to look like that in the end? Is that actually where we are in terms of, is it going to be as resilient as people hoped it would?
That makes a lot of sense, right? And you do see some of this in healthcare, the long-term care arena. Obviously, the workers and the home health aides have gained a lot of attention there. In the antitrust space, particularly under Lena Khan's FTC, there was a sort of renewed focus on the effects on doctors or nurses of the sort of financialization of healthcare. And, there's evidence that hospital consolidation can suppress nurse wages, for instance. So sort of go into this, the sort of broader arguments here. I think before kind of coming back to the sort of how lasting these are, your article also kind of focuses more broadly on the sort of corporate consolidation and financialization of healthcare. Do you think there are ways that this political economy approach helps address those specific issues?
I think there's definitely spaces where even, a fairly traditional approach to antitrust has a lot of potential to hit on some of these issues, right? I mean, like you mentioned, we've got increasing evidence that hospital mergers and certain other kinds of consolidations are driving prices up. They're potentially affecting wages. There's some evidence about their impact on health. And those seem like places where a fairly standard approach to antitrust enforcement that's maybe aggressive but not especially novel could do quite a bit. But I think there's other places where we have broader economic issues that are going to be hard to address. And I don't know. I don't know what the policy solution is to this. But we've kind of developed this system that is extremely complicated, very complex mix of public and private actors. We've got a lot of people who are very sophisticated in their ability to figure out the maximum way to profit in this market that's just inherently, it's got a lot of agency problems. It's got a lot of information problems. And so, what do you do about that, given the size of government as a buyer in the healthcare market? There's a lot more that we can do to think about how to ensure that prices are reasonable. And honestly, I think we need other ways to think about evaluating what fair prices look like in healthcare markets, because I think it is pretty clear that as the market's currently functioning, prices are really, sort of the competitive mechanisms that you would like to see keeping prices down are not really proving very effective.
That seems like a light statement, given how healthcare works. You kind of teed this up a little bit, but even more broadly, we're obviously in a political climate right now where this sort of care economy or the change you're describing doesn't seem terribly likely in the next few years. And sort of, does that change how you're thinking about these issues at all?
I think it does. Obviously, on the one hand, yes, with the exception of possibly, antitrust again, kind of bumping up against the healthcare space as being a spot where it's a little bit more open yet as to what exactly the policy approach is going to look like. But most of these changes are not going to be things that are on the table in the next few years. Looking back at what the lead up to change was during the Biden administration, I do think it's important to remember that things can change pretty quickly politically, that organizing, that sort of laying the groundwork that's happening now is still really worth doing, even if it takes a while to have a payoff. I also think the other thing that's useful to think about is that crises are often opportunities as well. And so if it seems like we're at a moment where there's sort of threats to parts of social policy that are providing access to people, where there seems like things are really under attack, that's also a time when people are sometimes willing to step back and say, wait, maybe we need to think bigger about this. Maybe we think differently about this. That can actually be helpful in kind of broadening the scope of debate. I think the main consideration that I have that's sort of a new thing is that it does seem possible that the Trump administration may be successful at hollowing out some of our state capacity, right? So we just don't have the administrative ability to administer some kind of complex new program. And so I do think it makes sense as we think about moving forward that perhaps it makes sense to consider simple programs over more complex programs, that we really need to recognize that administrative capacity may be a real issue, even if the political climate changes in the future.
The administrative capacity question is somewhat new this time around, right? The sort of large-scale firings of federal workers. And there's plausible cuts to state Medicaid programs that are on the table right now, which sort of can touch on state capacity here. And that sort of maybe the Medicaid discussion here maybe touches on a little bit of a question you alluded to earlier, which is, yes, we had these changes in climate policy and antitrust, and we're talking about these potential changes in healthcare. But, even if you are successful, how lasting are these changes, right? The Affordable Care Act had many near-death experiences. It has survived, but that does not have to be how it ended up. The Medicaid expansion is still under debate and may get drawn back, and hasn't happened in Florida or Texas. The Inflation Reduction Act, clean energy subsidies are certainly on the table for the reconciliation package this year. And antitrust, I assume, can basically change on a whim depending on the administration. So I'm kind of curious how you think about how lasting these changes are. And, right, is there anything you think that can be done to make changes more lasting?
I think to one extent, right, some policy areas are much easier to reverse under a new administration than others. So anything like antitrust, that's mostly the changes happening in the executive branch. Obviously, you change administrations, you change priorities, and you can take things in quite a different direction. I think even something like the Inflation Reduction Act, to some extent, I think the jury is still out there, right? Obviously, it created a lot of new economic interests in renewable energy that weren't there before, and that potentially may result in pressures not to repeal it from people who otherwise might be supportive of that. However, will that be enough to prevent parts of it from being repealed? We will still, I think we have to see. I think, the way to think of this, one, it's a long-term project. It's not a short term. So anything you do, I think, is subject to reversal. So one question is, how do you build both the politics and the sort of broader motivation for carrying a particular agenda forward, even though, of course, the short-term politics of it are going to go back and forth, and you might make a change in one administration only to see it step back later. And maybe that's, kind of a good note to bring it back to, is that another way to think of this is, it's a project, I think, that goes beyond just thinking about policy space to sort of thinking about civil society more generally. That I think there's space for non-policy actors as well to really think about how do we create a civil society network that says, this is what does it look like for Americans to live in a world that allows them to be healthy, right? And that gives them good options for care when they're not healthy. And that building that capacity outside of policy spaces is also something that in the long run can create more lasting change.
Oh, that's a good point. I think that seems like a good positive note to end on here. So I want to thank you again, Beth, for sharing your time and insights. And again, Beth is a professor at the University of Michigan. And to check out her article and the rest of the series on health and the political economy at Health Affairs Scholar, please check out the show notes, or you can look it up on Health Affairs Scholar's website. And thank you again, Beth, for taking the time.
Thanks. It's great to be with you.